Good afternoon, everyone. I'm so thankful to you, Tapushi, for that wonderful little introduction that you have given about me. And without much ado, let me start with the crux of my talk. Uh, uh, in the our department of public health in KJ Somaya Medical College Hospital and Research Center, we have been collaborating with the NGO Mina Foundation for since the year 2014, and we have been raising awareness about cancer, breast cancer in particular, and also implementing a screening program. Now, the screening program for whom? It is for the urban and the rural communities, wherein our urban and rural health centers are situated. In the urban and rural areas, that is in a village called Angaon, and in the urban slum population in Vidya Vihar. It's a place called Vidya Vihar. Okay, so we've heard a lot about the treatment of cancer, that is surgery, chemotherapy, radiotherapy. These are all the pillars of treatment of cancer. But one aspect of neglected, and which is very, very important, which has a huge impact on the mental state of a patient. Cancer can have a huge negative impact on the mental status of a patient, corroding the emotional well-being of the cancer patient. And ultimately what happens is that the patient does not adhere to the treatment, does not accept his or her disease condition, does not accept the treatment or delays the treatment, and eventually also does not adhere to the treatment plan, maybe the medical treatment, whatever is the treatment. The patient does not adhere to the treatment plan, and so this results in very, very disastrous consequences, and it also greatly impacts the prognosis of the cancer patient. So, what happens is that the emotional well-being. See, what happens when a person is diagnosed with cancer. Initially, the person becomes overwhelmed by this disease condition. The first question that comes to his mind is now, how long will I live? How will I interact with my family? How will I interact with my children? How will I interact with everyone around me? The second, completely overwhelmed also by the medical jargon that he or she hears. And the second is the anger. There is a lot of anger inside the patient's mind. Anger is, why does it have to be me? Anger against the medical providers, the people who are providing the treatment. Anger with those, even with friends who are healthy, and also against God. Okay, and there are other also very many emotions which create a huge impact on the mental status of a patient, like frustration, anxiety, depression, fear. All of this, they together, they create a huge mental turmoil inside the patient's mind. So how is the patient going to come out of that and accept himself, his disease, and also the treatment? Now, therein, the patient advocacy groups, the community healthcare workers, the medical social workers, the cancer support groups in the community, they play a huge, huge role there. And I'll tell you about what we do in our setup. Is that the medical social workers and the community workers, who are the community health workers, who are under the government system also. Some of them are recruited by the NGOs. We as doctors, we are training them. We are giving them a workshop, maybe about a 3-day workshop, and wherein what is taught in that workshop. In that workshop, we are telling them how you can raise awareness about cancer. With Mena Foundation, we have done this with breast cancer. Then also how to do the self breast exam demonstration of the self breast examination. And then also we are telling them how to do counseling, one to one counseling, group counseling. And we are provided with flip charts, these very well illustrated flip charts with which are in the local language. And the patient and these support groups, the people who are involved in these support groups, they actually go into the community, go into the patient's home, because they have they are accepted in the patient's homes because they are from the community itself. And all of this is these flip charts are used, other audio visual aids are used to help the community come to a grip, come to understanding the mental turmoils that can happen. And so they can discuss all their fears, their worries, their anxieties, can be expressed to these support groups and the cancer support group. And also, I think a very important component of the cancer support group are the cancer survivors themselves. If they are also involved in these support groups, or in these, when the community healthcare workers are going, also taking along with them these cancer survivors who can speak, you know to the cancer patients, it goes a long way in helping the cancer patients accept their disease and then go in for the treatment. So in our setup also, we have cancer survivors in the rural areas, in the urban areas, who are actively supporting and helping to raise cancer awareness, and also to help in the to adhere to the treatment plan that has been suggested by the doctors, and to go along with the treatment, and not to be emotionally so broken down that the further treatment is hampered. So that is a very important aspect that I would like to tell you about, what our what we are doing there. And I would like to conclude by telling you a little story about how this, in our setup, we had a cancer survivor who actually spoke to a lady who had breast cancer in the community. She had breast cancer. Initially, when she was diagnosed, she refused to accept her condition, and she didn't want to go in for treatment. Later on, she was convinced by the medical social workers and others to go in for the treatment. Ultimately, she underwent a modified radical mastectomy. Later, she was advised chemotherapy by the oncologist, and she was advised a cisplatin-based chemotherapy, the side effect of which is loss of hair. She was it was an emotional turmoil period for her. She did not want to accept the chemotherapy. She wanted to delay it. It was then that the cancer survivor, we had a lady, her name is Hirabai. She came forward, and she went to this lady, and she spoke to her and convinced her that all is not lost. And she told about her journey in it's a very perilous journey that she had faced during her days when she was battling the disease. And she then convinced her to accept the chemotherapy. And this lady then, she got a wig made for her just prior to her chemotherapy. So once her chemo, and that wig was like, as she looked at that present time. And then when she underwent the chemotherapy and lost her hair, she used the wig, and when she looked into the mirror, she saw there her old self. And so she realized that she was not lost at all. And she went in for the chemotherapy. She did all the treatment that followed, and she emerged victorious at the end. And she is now also a cancer survivor, actively working and in the community and helping to other cancer patients. I think with this, I can conclude by telling you that what a and I would also like to say, I have heard a lot about your Curia app just now, and I think it's kind of a magic app which can go a long way in helping our patients. Yes.